Very often people will tell us sleeping is the most important thing for a newborn child. When baby is sleeping, you let him sleep, you don't disturb him. Well, in reality, this is a very dangerous assumption because there are many situations where the child needs help to wake up and eat often enough and well enough. And it is always safer to wake up the child and breastfeed rather than letting the baby sleep longer. Let me explain. Many times, a child after birth will be too sleepy because maybe the birth was long and tiring. Maybe there were interventions during the birth that also put extra stress on the child, and baby is now unable to wake up easily by himself. Did you know that using anesthesia during the birth process makes the baby sleepier and unable to wake up as often? It is known through clinical studies that the use of epidural in birth often results in baby unable to wake up by himself as often as he should be doing it. Also, if the baby was born a little early, sometimes it's just a tiny bit early, not full term, but let's say 37 weeks and a bit. Full term is when the child went over 38 complete weeks and up. Between 38 to 42 completed weeks is the normal full term gestation period for children. But anytime before complete 38 weeks is prematurity. And many people don't know about it. They think that if baby was born 37 weeks plus, then mom was already in her months and the child was of good weight and good development and everything is fine. But the studies are showing that even when baby is a little bit earlier than the full term, this often leads to the situation where the child is not able to wake up as often as he should be, and he needs help to wake up and to eat properly. And of course, if the baby was early preterm, then this child will be even more likely to need help and assistance, because when babies are born prematurely, they don't understand that now they need to wake up and work at feeding, because when they are inside of mother's body, the nourishment comes through umbilical cord 24 hours non-stop and without any effort from the child. So when premature baby is born, often these babies are not able to understand that they need to wake up and feed, and we need to help them. So this may be a situation. And then, as I discussed in the video on when it may be helpful to insist on offering the second breast to the baby in the same feeding, even if baby already fell asleep, the same conditions apply to wake up the child more frequently for feeding, such as if the mother is engorged, her milk is arriving too fast, baby is not able to empty it properly. So mom is feeling uncomfortable, the breasts are swollen, painful. Maybe the mom skipped the feeding session for some reason, or baby slept too long and now she's feeling that the milk is becoming uncomfortable in her breast. This is the reason to wake up the child sooner, so that mom can release the pressure of milk and can protect herself from going into complications of plugged ducts and mastitis. And if mom already has plugged ducts and mastitis, where we have a hard area in the breast already overfilled with milk and blocked and it's hurting, it's painful, there may be a high fever in mom if she's already in mastitis stage, redness on the breast, this is another indication. Wake up the baby. Don't wait for baby to wake up. Wake up very frequently, every half an hour, every hour during the day, every few hours at night, so that you can empty the breast and overcome this condition sooner. Maybe the child is unwell. Maybe the child is jaundiced. Jaundice makes babies sleepier, so they need help from the parents to wake up more frequently and eat well. Maybe the baby has hypoglycemia. The sugar level is dropping. This baby also needs to wake up and eat more frequently. Maybe the child is in general unwell, maybe sick. The babies who are sick and unwell, they also will have less energy and they may need help to wake up, and letting them sleep longer is not helpful. And of course, if mom is increasing her milk supply, she's in a situation where for some reason her milk is not up to the demand of the child, the more frequently she will wake up the child for feedings, the more she will stimulate her breast and the more milk she will produce in return. So that's another situation where we will want to wake up the baby. And as it was explained in the video about how often we should feed the baby, if the baby is not able to meet the recommended 10 to 12 times of feedings per 24 hours in the early days after birth when we are producing colostrum, this is an indication we need to wake up the child. And then we want to continue waking up the baby so the baby meets 8 to 10 at least, as the white milk is already present. So we make sure we don't go below the recommended amounts for the first couple of days, and then as the white milk arrives. We also know that it takes us about 2 to 3 weeks to establish full milk production. And in these 2 to 3 weeks, the milk is constantly increasing and going up. But if we stay longer than 4 hours at any period in these first 2 to 3 weeks after birth, our milk starts returning back to blood, and the supply decreases and the production starts decreasing. So the first 2 to 3 weeks, we also want to wake up the child every time the baby is starting to go beyond 3.5 hours, so that we anticipate and we don't even reach the 4 hours. Because at 4 hours, it's that red zone where we're going to be losing our milk. And the first 2 to 3 weeks, we should be only increasing it, not losing. So the first 2 to 3 weeks, we always will wake up the baby if we're seeing the stretch of time going beyond 3.5 hours. After the couple first weeks, after the baby's above 3 weeks of age, if mom is comfortable, if the baby is gaining weight, if supply is well established, then we can allow the baby to be more flexible with staying longer between feedings and sleeping longer as he wants. But in the early weeks, we monitor very, very closely, and it is always safer to wake up the child than letting the baby sleep longer than he should have.